orthodontists want to do aligners. It's a new technology that works really well. Does not apply to everything, and I'm not here to talk about aligners and orthodontics. I'm not an expert on aligners and orthodontics, but I do know that is an expanded area, expanded technology that's very valid, as is the technology associated with treating this temporomandibular joint easily, non-surgically. I treated this joint surgically for 36 years until I decided the benefits and the success rate were not high enough. Yes, there were benefits. Yes, there were successes. But a third of the patients that I treated surgically would be back within a year or two with the same symptoms, no matter what kind of surgery I did on this joint, which led me to do the research and develop a non-surgical treatment for this that did nothing more than nothing less than relieve the inflammation within the joint. That is what this device does in protocol. It's a device in protocol that does nothing more than alleviate, decrease, take away inflammation within the joint. If inflammation causes all the symptoms, by decreasing inflammation in the joint, the symptoms go away. It's that simple. So it's a device in protocol, discussed elsewhere. I won't discuss that again. We're discussing the integration of dentistry and medicine, and why the treatment of TMD is the best example I can find, the best example I can think of, is how and why the education and the use of the dental profession should be integrated into medicine. As a trained dentist, I can tell you it takes a while to learn how to cut up a tooth and restore it. And it is very precise. And actually, it's very hard. It's a very hard profession to do. It's very hard on the dentist's body, leaning over a chair and working in such a small area, even though the technology has improved with lighting and instrumentation and high-speed drills. It's very hard on the dentist's body, and it's very hard to learn how to do that very precise. It's actually just as precise as brain surgery. It's just you're working on a tooth rather than inside the cranial cavity. Everybody thinks that brain surgery is so precise, and it is, and it's difficult surgery. But I can tell you, cutting up a tooth, cutting into a tooth, and preparing it for a filling or a crown or a bridge or putting in a dental implant is actually much more precise than a lot of